Good morning, dear students. Today, I'm going to discuss about the topic alveolar bone. So these are the important questions from previous year's question university exams from this topic. Kindly make a note of it. This alveolar bone, I'm planning to take it in two sessions. The first part, I'll discuss in detail about the structure and the composition. And the second part, I will discuss about the molecular biology of alveolar bone in health and disease. So please make a note of all these important questions from the previous year's asked university exams. And another important thing is, before going to the topic in detail, what is the significance of this particular tissue, alveolar bone? So you, as like alveolar bone structure and composition and even function should be known by all the clinicians or the dentist, because you deal with alveolar bone during your clinical practice. As well as knowing about the structure and composition is also important if anybody is interested to do this research on bone therapeutics. So you have to know about in detail about the alveolar bone compositions. Clear? So these are the contents of this topic. That is, as I mentioned before, I will take this particular topic in two important sessions, right? So the first part being structure and composition. So I'll brief you about the development of the alveolar bone, parts of the alveolar bone, composition of the alveolar bone. It's just a small definition for this particular topic. So whenever you get in a question regarding alveolar process bone, so you have to mention. This is a very simple definition for all the students. Like alveolar process is that part of the maxilla and the mandible that forms and supports the teeth socket. So the teeth are fixed into this alveolar sockets and it is attached to the bone via the periodontal ligament. Okay. So just an overview about the development of the alveolar bone. So the formation of the alveolar process starts in the early fetal life, precisely the second month of fetal life. And as you all know, must have learned in your first year BDS classes in general embryology, dental anatomy, that bone formation occurs via two important mechanisms, that is intramembranous bone formation and endochondral bone formation. And both maxilla and mandible develops by intramembranous ossification. So alveolar bone develops from the, just have a look at the picture, the alveolar bone develops from the dental follicle during the tooth eruption. Okay, and the major changes in the alveolar process begin to occur with the development of the roots of the teeth and tooth eruption. So the tooth germs developed within the bony structure is clearly outlined by the bone compartment. And as the roots of the teeth develop, what happens? Some cells in the dental follicle also differentiate into osteoblast and they form even alveolar bone proper. And the formation of the alveolar bone starts with small, you can see on the right side picture, that small foci in the mesenchymal matrix around the tooth germs. And later, what happens? This mineralizing foci fuse and develop around the erupting tooth. And along later stages, the blood supply, like the inter arteries, mesenchymal forms periosteum, and even the blood vessels. From the blood vessels, even what happens is that osteoprogenitor cells will be differentiated and they migrated over to the, and they helps in the overall bone formation. So this is just in brief about the osteoblastogenesis and osteoclastogenesis. I highlighted these two because these the osteoblast and osteoclast play a pivotal role in alveolar bone. So one helps in bone formation and the other helps in bone resorption. They have a coordinated action. So what are the functions of the bone, alveolar bone? So the main function being providing the framework. They are the storehouse of calcium. They provide blood supply to periodontal ligament. They distributes the occlusal forces. They provides anchorage. They protects the developing tooth bud and organize and controls the eruption of the teeth. So these are the main important functions of the alveolar bone. So let's see the structure of the alveolar process. Okay, physiologically, the alveolar process consists of two important parts. That is alveolar bone proper, your other name being the bundle bone, or the component of the alveolar bone proper are two important components. That is the bundle bone and the lamellated bone. And the second being the supporting alveolar bone, the outer cortical bone and central spongy bone. So just have a look at the picture. So the cortical plate and the alveolar bone proper meet at the alveolar crest. So you like clinically while doing the surgery and even from the radiographs you can identify this part. The cortical plate and the alveolar bone proper meet at the alveolar crest, that is 1.5 to 2 mm below the level of the CJ on the tooth it surrounds. So when you look into the structure in detail, the alveolar bone proper, as I mentioned before, two important arms or the components, that is the bundle bone and lamellated bone. So basically this alveolar bone proper, it surrounds the roots of the teeth and gives attachment to the periodontal ligament fibers. So the alveolar bone proper has got two important parts. One is lamellated bone and the bundle bone. So in even little detail about the lamellated bone, there are three different types of the lamellated bone or the structure wise. That is one, the concentric lamellae arranged concentrically around the Haversian canal. Second, the interstitial lamellae, the lying in between the intact osteoid. And the third being the circumferential lamellae covers the outer and inner periphery of the cortex, external circumferential and internal circumferential lamellae. So what is bundle bone? This is a very important short note. So bundle bone is also known as alveolar bone proper, and is a histological term. It's a further portion of the bone of the alveolar process that surrounds the teeth into which principal fibers of the periodontal ligament are embedded. And bundle bone contains fewer fibrils than the lamellated bone. So therefore, it appears dark in routine H&D stained section. So you can appreciate very well from the histological picture that it appears dark. And the bundle bone is also called as lamina dura in radiographically. The radiographic the term being the lamina dura because of an increased radio opacity. And this radio opacity is due to the presence of thick bone without trabeculations and increased mineral content around the collagen fiber bundles. So once again, I'm reminding you, please make a note that the bundle bone is also a very important short note. Let's look into the supporting alveolar bone. Supporting alveolar bone, the anatomically it is the bone that forms the labial and lingual covering of the alveolar bone proper. From the picture, it is very clear that there is like a cortical bone and spongy bone. Supporting alveolar bone comprises the cortical bone and spongy bone. Okay, and this is a picture a little more clearly. You can see the down arrow depicts the cortical bone or the compact bone, and the upper arrow depicts the cancellous bone. The cancellous bone, the other name being the spongy bone, the supporting spongiosa. As the picture, you have seen in the picture that it fills the space between the alveolar bone proper and cortical plates. Little more in detail, this cancellous bone has got two types. One, type 1, they are predominantly present in the interdental and interradicular septum, and the tropically arranged horizontally in a regular ladder-like pattern. You can appreciate very well in the radiographs too, and they're more common in the mandible, and they're more resistant to force of mastication. Whereas type 2, the bone trabeculae show irregular arrangement, numerous and more delicate interdental and interradicular trabeculae, and they're common in the maxilla, and they're less resistant to the force of mastication. So the next being the interdental. As I mentioned, the interdental bone is seen between the alveolar sockets. Then the interdental and interradicular septa contain perforating canals of sacrocantal and Hirschfeld, which house the interdental and interradicular arteries, veins, and lymph vessels and nerves. Let's have a look on periostem and endostem. The periostem, which lines the outer portion of the alveolar bone, endostem, which lines the inner wall of the alveolar bone. So when you look into the periostem, again, periostem is not asked as a short note. Is this picture, I hope it is very clear for you. The right, picture, the left side picture, where you can see that periostem covering the alveolar bone. When you can see it very clearly when you do clinical cases, surgeries. And periostem, again, you have three important layers. That is the osteogenic layer, the cambium layer, which is very rich in blood vessels and fibroblasts, the osteogenic layer, which is rich in the cellular source, and the third being the collagen, zone 3 being the fibrous layer, predominantly made of collagen fibers. Okay, and you have periostem derived stem cells too, and they play a very important role. They are similar to mesenchymal stem cells, and they will play a very important role in regards to wound healing. They promote revascularization, they provide growth factors, etc. So next, see the next important aspect of the alveolar bone, that is the composition. Okay, so we have covered the structure of the alveolar bone. Second, we are going to deal with the composition of the alveolar bone. The composition of the alveolar bone comprises inorganic, around 65%, organic 35%, and the cellular composition. Okay, and so let's have a look at the cellular composition of the alveolar bone. Predominant cells, the bone cells, being the osteoblast, which forms the bone matrix, osteoclast, which resorbs the bone. You have osteogenic cells, they are the stem cells, and the last one being the osteocytes. Okay, so let's have a look on osteoprogenitor cells. Osteoprogenitor cells, they are also known as osteogenic cells, are the stem cells in the bone. They play a prodigal role in bone repair and growth. They are undifferentiated mesenchymal cells located in the deepest layer of the periosteum. They have pluripotency function, and they lines the Haversian canals of the compact bone. My dear students, please make a note of this valid points regarding osteoprogenitor cells. So let's see about the important cell of the alveolar bone, that is the professional secretory cell known as the osteoblast. The osteoblast originate from the progenitor cells present in the bone marrow, are these cells responsible for the bone formation. And histologically, as compared to like other cells, they are elongated cells with basophilic cytoplasm, cuboidal in shape, and they have a well-developed rough endoplasmic reticulum and a Golgi apparatus that are typical of bone secretory cells. Okay. And few more points to add, valid points regarding osteoblasts. They occupies 4 to 6% of total bone resident cells, and they lines the inner endosteal and periosteal surface of the bone. About 10 to 15 of osteoblasts become osteocytes, and they secrete bone matrix proteins. You can make a note of all the important bone matrix protein. I'll discuss in detail about this bone matrix protein at the end. And they synthesize the enzyme alkaline phosphatase and initiate the process of mineralization. And what are bone lining cells? Okay, bone lining cells they are inactive osteoblasts. They covering the bone surface, or quiescent osteoblasts covering the bone surface. You can see outside, lining the outermost portion of the bone. They have important functions like they maintain the bone matrix. They have a pivotal role in bone remodeling. They buffer the calcium, and they also respond to mechanical stress. So they are now the researcher says that they are the sources of active osteoblast, and they are target cells for anabolic agents in bone therapeutic research. So the other important additional points regarding the osteoblast being that the bone, there are certain cell markers to identify the particular cell, and they have said that the osteoblast markers predominantly when the osteoblast turn to osteocytes, mean like when the once the function is really function is over by the laden of bone, the osteoblast, the few of the osteoblasts, they convert it onto osteocyte. They get embedded in the bone matrix. Those are called osteocytes. So even you can identify that during the transition of osteoblast to osteocyte, there are few markers get expressed onto the cells. And there are certain markers, like as I mentioned, those who are interested have a note of all these markers. There is a little onto the higher end. In fact, these cells express this typically the mature. If you want to identify a mature osteocytes, you can use all these cell markers. They will be expressed in mature osteocytes. And osteocyte apoptosis has been recognized as a chemotactic signal to osteoclastic bone resorption, because osteocytes, the current research says that the osteocytes are the orchestrator for bone remodeling function. So even the researcher says that the osteocyte structure, I hope you must have like draw this osteocyte picture in your record books in the first year, right? Even for your third year BDS, right? The osteocytes, you'll have this canaliculae and you have the cilium structures. Like, you must have seen this. Like this, you will express when you draw a diagram on osteocytes, you will mark all these extra structures, right? And they act as the mechanosensors, as their interconnected network. These dendritic cellular structure helps to interconnect with the other cells around, right? Network has the capacity to detect mechanical pressures and loads, thereby helping the adaptation of bone to daily mechanical forces. This is very important, and there are a lot of researches going on to this aspect. Coming to the last cell, the osteoclast, they are the multinucleated cells derived from the hematopoietic progenitors of the hematopoietic progenitors of monocyte macrophage lineage. And there you can see that osteoclast is quite different from all other cells. Okay, and they have this process, the ruffled border. The mature osteoblasts will have a ruffled border, and this ruffled border have a high cellular activity, and they have this hydrogen pump. They can release the lysosomal proteases, they can release the tartarate resistant acidities, and there are so many other receptors around the osteoclast cells to do this bone resorption activity. So this part, the osteoclastic induced bone resorption, I will take it in the next session on the molecular biology of alveolar bone in health and disease. Predominantly, when they do the bone resorption part, they decalcify. The decalcification process is initiated and followed by degradation of the organic matrix, and the degraded matrix will be transported out via exocytosis to the extracellular fluid or the blood. So coming to the composition part, the bone matrix. The matrix component of the alveolar bone consists of collagenous proteins and non-collagenous proteins. The collagenous protein comprises major 80 to 90%. Organic component in the mineralized bone, the organic component in the mineralized bone tissues being the type 1 collagen, they predominates around 95%, followed with type 5, 5% of the collagen. And type 3 and type 12 are also present. So the collagen types type 1, type 5, type 3, type 12. Okay, and the type 1, 5, and 12 are produced by the osteoblast itself, and type 3 is produced by the fibroblast. So the non-collagenous protein comprises the osteocalcin, nectin, osteopontin, xyloproteins, proteoglycans, etc. They approximately counts for 8% of the organic matrix. And it has been said that the numerous non-collagenous components of the alveolar bone have been categorized by Roby et al. Into proteoglycans and glycoproteins. This is just for you to know about it. So proteoglycans and glycosaminoglycans are the hardcore of the extracellular matrix of any tissues in the periodontium. So proteoglycans have a core protein into which one or more heteropolysaccharides called glycosaminoglycans are covalently linked. Example of being the versican, decorin, glycan, fibromodulin, osteoglycine, osteoadherin. As you undergraduate level, you have to know about the names of all these things. And the glycosaminoglycans, they consist of repeating carbohydrate units that are sulfated, such as chondroitin sulfate, dermatin sulfate, and keratin sulfate, and heparin sulfates. Okay. And so being like Robbie et al. Have categorized into the non-collagenous components of alveolar bone into proteoglycans and glycosaminoglycans. Okay. So this slide shows that I have discussed about the composition of the bone, that is the bone cells, organics and inorganic composition. So organic and inorganic composition derived from the physiological fluid, and the bone cells, as I mentioned, that is they have this the precursor cells, the hematopoietic organs, or the like mesenchymal progenitor cells, right? And these bone cells, organics, inorganics, matrix, along bone cells, along with the organic, the extracellular matrix of the bone, they maintain the bone homeostasis. If anybody is interested to know further, just put up this diagram. Please make a note of this slide. So let's recap. So today's class, I have discussed about the structure of the alveolar bone and the composition of the alveolar bone. The structure of the alveolar bone, as I mentioned before, you have this alveolar bone proper, you have this lamellated bone and the bundle bone. And you have the supporting alveolar bone being the cortical bone and what cancellous bone, okay, and the interdental bone. And when it comes to the composition of the alveolar bone, as I mentioned, we have discussed the inorganic matrix, the organic matrix, and the cellular composition of the bone. Okay, so this is all about the today's class. And as I mentioned in the first slide, I think everybody must have copied that slide, the important questions from this portion. Once again, I repeat the important university questions like what the structure of the alveolar bone or the parts of the alveolar bone. Or you can get questions separately like the bundle bone, alveolar bone proper, or bone cells in specific like osteoblast, osteoclast, etc. Okay, so in the next session, I'll deal in detail about the molecular biology of alveolar bone in health and disease. With that, I end my class. Thank you all my dear students for your patient listening. Thank you. Have a nice day.